What if I told you that we could map the spread of a disease using the exact same tool economists use to map wealth inequality? It sounds kind of wild, but that is exactly what researchers in Australia are doing right now. And honestly, it's a brilliant example of out-of-the-box thinking that has real life-saving potential. Yeah, I know what you're thinking. That seems like a really strange connection, right? You've got economics over here and public health way over there. But the answer to this question, well, it reveals a powerful new way to make our public health strategies smarter, way more efficient, and a whole lot more effective. So, to really get why this is such a big deal, let's first take a look at the problem that health officials are facing. It's a classic challenge. Infections are on the rise, but resources, they're not. So like in many places around the world, STIs have been climbing in Australia for about the last decade. But public health budgets are always finite. They can't do everything for everyone all at once. So they have this critical choice to make. Do they launch these big, broad awareness campaigns that hit everybody? Or do they focus their limited money and time on specific high-risk groups? Getting this wrong doesn't just waste precious money, it literally costs lives because it fails to stop the spread of infection. And this is where our story takes a really fascinating turn. Instead of digging for a solution inside the usual public health toolbox, researchers looked somewhere completely different, to a classic tool that's been used for decades to understand how wealth is spread out in a society. All right, so how on earth does an economic tool help decode disease risk? Let's break down the core idea, because it's actually pretty clever. It's all about something called the Gini coefficient. All you need to know is it's a simple score that goes from 0 to 1. A score of 0 means perfect equality. Everyone has the exact same amount of something. A score of 1 means perfect inequality. One person has absolutely everything, and nobody else has a thing. Think of it this way. Imagine you're at a party with 100 people and 100 cookies. A Gini score of 0 means everybody gets exactly 1 cookie, fair and square. A Gini score of 1, that means one person gets all 100 cookies and the other 99 people are just out of luck. It's a really simple but powerful way to measure how concentrated something is. Okay, now here is the brilliant leap. The researchers just swapped out cookies, or wealth, with infection risk. By calculating the Gini score for different STIs, they could suddenly see how these infections were actually distributed. A low score means the disease is spread out pretty evenly across the population, but a high score, that tells you the disease is packed tightly into a very small, very high-risk group of people. So what happened when they actually applied this to the real-world data? This is where it gets really interesting, because it turns out not all diseases are spread out in the same way, not even close. First up, chlamydia. It comes in with a Gini score of 0.31. Okay, so that's a pretty low score. It tells us the risk is quite spread out across the general population. Then we have gonorrhea, a little bit higher at 0.38, so a bit more concentrated than chlamydia, but still, fairly widespread. But then, whoa, look at this. HIV takes a huge jump up to 0.57. All of a sudden, we're seeing a much, much higher concentration. The risk is really starting to cluster in specific groups. And finally, topping the list is syphilis with a score of 0.60. This is telling us that new cases are extremely concentrated. Most of the infections are happening within a very, very small slice of the population. So that's the overall picture, which is already pretty insightful. But the real aha moment, the key to this whole thing, is what happens when you slice this data up by different population groups. The numbers don't just shift a little, they tell a completely different story. And the difference is just staggering. Look at the group of gay, bisexual, and other men who have sex with men, or GBMSM. The Gini scores are pretty low. Chlamydia and gonorrhea are down around 0.23 and 0.24. This means the risk is pretty widespread within that community. But now, look over at heterosexual men and women. For HIV, the scores are an unbelievable 0.94 and 0.96. That is incredibly close to 1. Perfect inequality. This chart just says it all, doesn't it? For HIV, it's like we're looking at two completely different epidemics happening at the same time. In the GBSM community, the risk is more broadly distributed. But for heterosexuals, that Gini score of almost 1 tells us the infections are hyper-concentrated in a tiny, tiny fraction of that population. It's not a widespread issue, it's a highly targeted one. So what in the world do you do with this kind of information? Well, this data gives us a crystal clear roadmap for action. The researchers have a great name for it, the sniper versus sprinkler approach. The logic is actually beautifully simple. First, you measure the Gini score. If that score is high, it means the disease is concentrated. So you use a sniper rifle strategy, a precise, targeted effort aimed only at that small, high-risk group where the infection is clustered. But if the score is low, the disease is spread out everywhere. A sniper rifle is useless. You got to bring out the sprinkler and use broad, widespread screening across the entire community. So let's apply this. For heterosexual men and women, those crazy high 90 scores for HIV and syphilis, we're talking over 0.9, that's a flashing red light. The most effective, most cost-efficient strategy is a sniper approach. Focus your resources on finding and helping those very specific, high-risk individuals. In complete contrast, for the GBMSM community, those much lower Gini scores tell a totally different story. The infections are more evenly distributed. So the best strategy is the sprinkler, widespread screening programs and interventions that reach the whole community, not just one small part of it. And you don't just have to take my word for it. The researchers themselves lay it out perfectly. The data tells them exactly how to use their money and people for the biggest impact. It's not about treating every group the same. It's about tailoring the strategy to match how the disease is actually behaving on the ground. And that really is the heart of it all. By borrowing a simple concept from a completely different field, these researchers created a powerful, data-driven guide. It lets public health officials move beyond just guesswork and deploy the right strategy in the right place for the right people. It really makes you wonder, doesn't it? If a tool for measuring wealth can help us fight disease, what other amazing breakthroughs are just sitting out there waiting for us at the intersection of fields that seem like they have nothing to do with each other? That's definitely something to think about.